Hello, my name is Courtney Kokenauer, and today I'm going to show you how to assemble inhalers and how to assemble a nebulizer. Let me first start off by washing my hands. When a patient comes into the clinic and they're just coming in for like a cough or tightness in the chest, we would do an oxygen level. So this is a pulse ox, and what we do is we're going to measure the oxygen level and for the pulse. There is a red little light, and you're going to put that on the nail bed, and we're going to wait to see what our oxygen level is. You can see it's 87. At this point, if it was truly 87, we would administer oxygen on top of the medication for the breathing treatment. So I'm 98%, 99%. That's very good. Anything below 95 is not good. So we'll come over here. I want to show you. This is the home asthma management plans. I am 5'4", which equals to be 64 inches. So I would come over here. If I was in the red zone, which is 215, I would be in very bad shape and I'd need to get to an ER as soon as possible. With the yellow zone, I would be able to manage it by taking my medication, as in my rescue inhaler. If I'm in the green zone, I'm doing great. Good job. Keep it up. All right, let's come on over here. So first, to see what kind of zone we're in, we are going to use what is called a peak flow meter. So let me show you up here. You have the red, the yellow, and the green. Now these will be placed where you should be at for your height, because peak flows go by height. So you're going to attach the mouthpiece, and you want to make sure that this is not covered back here. So you're going to hold it just like this. I want you to take a deep breath in, and then you're going to push out as hard as possible. We're going to do this 3 times. The number that is the best out of those 3 times is what we consider your zone. All right, I'm going to do an example. You can see I made it to 550. Coming over here, I'm over my green zone, which means I'm very good, I'm in good shape. So now that we've done this, I want to show you if I was having an asthma attack, I would do immediate nebulizer, an albuterol that will open immediately and relieve the symptoms of a person with asthma. But first, let's do our maintenance drugs. Here is an ordinary inhaler. You have your medication, and you want to make sure that the bottom is going in so you get the correct assemble. When you're using this, you're going to shake it up. You can either hold it away from your mouth and take a deep breath in when you go to push the button, or how I have been trained is to securely wrap your lips around the opening, like so. When you squeeze it, you're going to inhale at the exact same time. So, for example, take a deep breath in and then release it. You want to hold that breath for a couple seconds to let that medicine get into your lungs. There are other types. Pulmicort and Advair are typically used as maintenance drugs. They have steroids in them that help maintenance your treatment. So you'd use this as prescribed. Sometimes you can take 1 to 2 puffs once a day or 1 to 2 puffs twice a day. Depends on what your doctor says. For Advair, you would move it like this and then click it to get your, and then breathe in through this hole. For Pulmicort, it'll be like this, and you actually twist the medication and then breathe in. Those are used for children over the age of 8 and then also for adults. Now for babies or children under the age of 8, you attach the inhaler to what is called an aero chamber. Okay, so you're going to place that in there. You'll squeeze the medication. Now that medication's in here in the chamber, that gives it so the patient can securely wrap their lips around and just take the deep breath in and they get the actual medication. Same thing, this is typically used for more of the babies. Same thing, you're going to secure it in there, push it, breathe in. Okay, so now what I'm going to show you is a breathing treatment from a nebulizer. Nebulizers are used when you're needing your albuterol for rapid relief. So typically it starts out looking like this in the clinic setting. Now you'll already have some at home typically for an asthmatic patient. What you're going to do, you have your chamber that the medication goes into. You can see that it's blue on the inside. Some nebulizers are color coordinated. You can see there it's blue on here. So you're going to connect them together. And then you have these 3 separate pieces. You've got a mouthpiece, a chamber piece, and then a piece to connect all of it together. You'll put this piece on top, and then a mouthpiece, one on each side. Alright, so in this demonstration, I am going to use saline solution. That way we're not using any medication. Also, you're going to attach this to the nebulizer. This is for electricity. If a patient comes into the ER or the clinic in distress, that means their oxygen level is below 92%. We would use oxygen, which means you would do the same setup. You'll take this though and attach it right here and then turn on. And then what this will do will administer oxygen on top of the medication to help open those bronchioles and get oxygen into the bloodstream. But for this demonstration, we're going to use the nebulizer. You want to make sure that the nebulizer is also plugged in before we start or it won't work. You will take the medication, squeeze it into the chamber. This can take up to 5 to 10 minutes. You're going to secure it on there. Whoop. This typically wouldn't happen. I'm going to use a mask just because for babies it's easier to follow around with them because as we all know, children don't like to stay still. So you just attach it. Instead of using the mouthpiece, you use the mask. You're going to turn it on. You see the smoke coming out? You would follow the patient around, or if they allow you to, you'll secure it around their face. Now the thing is we don't want to scare our patients. You want their very first experience to be a very well experience so they continue to do this. Adults can use it too. It's a lot easier to give a treatment one-handed than having to do it with 2 hands. So at the end, we're going to retake the pulse ox 5 to 10 minutes after the treatment just to make sure that it's worked. If it hasn't, other treatment will be provided. So at the end, in the conclusion, we should know how to use a peak flow meter, how to assemble and use a regular inhaler and an aero chamber inhaler. And we know that the difference. Albuterol is for immediate relief. ProAir, Advair that has the steroids are maintenance drugs. We also have our nebulizers. You have your mouthpiece for older kids and adults. And you also have the mask for babies or adults. Depends on what you like to do. Hand spray would be easier. And also, some adults have oxygen at home to administer it. These are patients that can have like emphysema or things like that. So if there's any other questions or concerns, please let me know and I'll do my best to help you with them.